Welcome back. If you've ever heard of a mesotherapy, it was probably in connection with dissolving fat. But Dr. Clark Hansen joins us now to talk about the other benefits of mesotherapy. It's good to see you.
Good to see you.
Now, you said, too, that in France they've been using mesotherapy for quite a long time.
Yeah, it's just new to the United States, but it's been used in France since 1952. And about 2004, I started getting information about it. So I actually speak French. So I corresponded with Dr. Jacques Lacaze, who's the world's leading authority in mesotherapy, and he invited me over to Paris to study with him. So I went and spent a week in his clinic with him learning all about it and how to do it.
I've heard of it, but I really don't know what it is. So what is it?
Well, mesotherapy is using micro or small doses of vitamins, minerals, homeopathic medicines, combined with conventional prescription medicines, injected right into a specific target area in the mesoderm.
We have a picture of the skin, right?
Right, so that's the middle layer of the skin.
Okay.
So right in the middle there is where you have the connective tissue. That's the collagen and elastin in between the skin and the fat cells, the lymphatic system, the blood vessels. So this really gets right into a specific area to treat the body. So you see...
Yep. Here comes the picture, and this kind of exactly what you're talking about.
So you'll see that white layer in the middle, the dermis, the middle of the dermis, you'll see, it's hard to see the fibers that go through there, but those are collagen and elastin. That holds all the body together, the skin, the cartilage, the blood vessels, the joints. If we didn't have collagen, we couldn't stand erect.
I see.
And we'd have hardening of the arteries, we'd have stiffening of the joints, wrinkling of the skin, and cellulite. And so in America, what we grabbed onto was the treatment for cellulite and fat.
Right.
Because just underneath that middle dermis is the fat layer. And when that connective tissue gets weakened, then the fat starts to kind of, well, you got to be fat, you got to add fat, and then you have poor connective tissue. So there's two things. Too much fat and a weak connective tissue allows that fat to kind of create that dimpling effect that causes cellulite.
Right.
So summertime, you want to go out and get in the bathing suit, and you've got the cellulite, got too much fat. In the United States, this therapy's kind of been used specifically for that.
But you're saying it can be used for a lot of other things, too.
Right. I was so amazed when I went to Paris to learn. They use it for arthritis, migraines, TMJ, temporomandibular joint pain, muscle spasms, degenerative disc disease. And I've used all those things in my practice, and amazing results.
Well, now how does it, what is it? Is it needles? Tell me what exactly happens to you.
It's an injection of these materials and right into that mesoderm area. So if it's your knee, the ligaments, the tendons around the knee, we inject maybe 6 spots around that tendon or ligament that's damaged. Okay. And it increases circulation, lymphatic drainage, decreases inflammation, and brings that healing nutrition to the area. So it regenerates that collagen and elastin in that ligament or tendon.
I see.
And instead of taking a drug in America with pharmaceutical industry rules, and so doctors are used to just giving a drug. You may have heard of Celebrex, Vioxx.
Yes.
Vioxx was taken off the market because on the way from the mouth to the knee, it doubles the risk of a heart attack. People were dying. Celebrex probably will be taken off the market in a few years for the same problem.
So this
so
goes
they
right
go
to
right to the area.
I see.
It doesn't have any side effects because it stays locally, so it doesn't cause ulcers like these non-steroidal anti-inflammatory drugs do. And it increases that healing response right there locally. And we do like 3 treatments, 1 to 2 weeks apart, and we see people that have not been able to walk, you know, hardly, are now walking and not in pain. Degenerative disc disease. I have a patient who had auto injury 3 years ago. He's been in pain every day since. He's got 5 bulging discs in his lumbar spine, and he's been in pain until he got mesotherapy. Now he's finally out of pain for the first time in 3 years.
So once they go through a series of treatments, these injections, are you good from there on out, or do you come back maybe for maintenance?
Well, what it does is this starts to give the body a chance to rebuild itself. So usually we see like a patient that had TMJ. I used to treat her with acupuncture almost monthly, and now she hasn't been back for years, so it's just totally gone.
Wow.
The fat cells, when you do the injections, which is a little bit different materials, but right into that mesoderm, it dissolves down into the fat, dissolves the fat cell membrane, and just removes it. Well, so then the fat just is expelled and is absorbed into the other tissues and removed from the lymphatic system, and that fat cell is gone. It'll never come back.
Wow, I'm liking that. So it's got
So,
many benefits.
yeah.
Arthritis, you mentioned some of the diseases, plus everything from cellulite to all the way to these.
So a lot of pain syndromes we use it for.
Great.
And we treat it not only the mesotherapy the injections. A lot of people don't like needles. And just recently we came out with, it's not our product, but Leger
right.
Pharmaceuticals has a new product that's a mesoderm topical that increases the effectiveness. And we're seeing patients losing 40 to 50 pounds over a 4-month period.
Just
and
by
losing,
the creams?
But diet and exercise and the creams alone, losing 13 to 18 inches, 40 to 50 pounds.
Wow.
And so we're real excited about that. And then
Thanks, Dr. Hansen.
the grapeseed extract internally we give to build that collagen and elastin. Fruits right now, these are in these fruits. We got to eat more of them while they're in season.
Yeah, but nobody's going to eat that big whole bowl, so you can just do this instead.
Get the seeds, the grape seeds.
Thank you so much, and this may have disappeared. And if you'd like to call Dr. Hansen, thank you so much.
Yeah.
Great information. Go to drhansen.com. There's the phone number right there on your screen. It's the Hansen Clinic of Natural Medicine for more information. Thanks for breaking down what mesotherapy is, because I know we're going to hear more and more about it.
Tell them to go to our specials section on the website.
All right, well, thanks again, Dr.
All right, thanks.
Hansen.